Hello everyone, welcome to Vaso-Meditech EECP Treatment Center. Today we are going to discuss about one of the important cardiac risk factor called hypertension. So what is hypertension? Which is elevated blood pressure is called hypertension. So when I say elevated, then there should be something called normal blood pressure. So what is the normal blood pressure? Usually in young adult up to 70 years of old, the normal blood pressure should be around 120 to 80. The top one should be 120 and the bottom should be 80. The top one is called systolic pressure and the bottom is called diastolic pressure. So it is allowed up to 130 millimeter by mercury. So when you are young, around 120 to 130 systolic pressure would be considered as normal. Sometimes if the pressure goes beyond 130, then you are called as hypertensive or stage 1 hypertension. These patients should be cautious about their health because the pressure is mildly elevated. And also we should understand, as you age, the blood pressure also tend to increase as you age. So when you are around 70 to 75 years old, now 120 over 80 is not considered as normal and it can be up to 140 or 150 can be normal. So in elderly people, it's beyond 150 only it considered as hypertension. Now the next important question is, why hypertension is so important that you need to take care and you should monitor. Now the blood pressure within your artery is called systolic pressure. So the blood pressure within your artery determines the health of your vascular system. So your body has a lot of blood vessels, and all this blood vessel health is a reflection of your blood pressure. So if you have a normal blood pressure, means your vascular health is very good. So internally you are young, your vascular health is normal. If your pressure is high, means your vascular health is not normal. So you should understand your vascular health is directly proportional or directly equate to your life. So your life is as long as your vessels are healthy. If your vessels are not healthy, it predisposed to lot of complication. That is why we say when you have hypertension, your risk for heart attack, your risk for stroke, your risk for renal failure, your risk of aneurysm, all this goes high because your vessels are not healthy. Now let me explain how to determine whether your vessels are healthy or not. So just think heart as a pump, which is actually a pump which pumps from the day you are born to the day you die. So this pump has to constantly pump and put pressure in your artery to move the blood across all the part of your body and also to all the cells in your body. To do so, the pump has to be aggressive. It has to keep on pumping and maintain a pressure inside the artery so that the blood will move in the artery. So when you are young and your vessels are healthy, the vessels also assist your heart in pumping. How it does is, the vessel will be so elastic that it can dilate and constrict. So when the heart pushes the blood, which is a systole, the vessel dilates. When the heart is in the diastole, when it relaxes, the vessel constricts. So what will happen is, when the blood flow in the artery is pushed not only by the heart and also by the elastic vessel by dilating and constricting. So when you have hypertension, what will happen is, this elasticity of the vessel is sacrificed. So rather than become elastic, the vessel becomes stiff. Once the vessel becomes stiff, then the heart will be the sole determinant of the pumping action. So the heart has to pump harder and harder to push the blood into the vessel, which is very thick or stiff. So this will lead to straining of the heart. So it's a very simple fact. If you have a pump which is straining a lot, then the pump will fail earlier. So that is why patients with hypertension, they more frequently get heart attack and heart failure, and the heart will fail to pump. So it is very important to control the blood pressure or to improve the vascular health. So how does this blood pressure causes renal failure or stroke or a heart attack? As I said before, because of the stress is very high in the heart has to strain to push the blood. What will happen is, the heart muscle become thicker and thicker. So when it becomes so thick, the normal blood flow is not sufficient for the heart muscle. So because of the lack of blood flow, you will suffer a heart attack, and if you suffer a heart attack, then you go for a heart failure. Second is kidney. Because the vessel is becoming very stiff, the flow in the kidney is also affected, which can lead to a renal failure. And third important consequence of high blood pressure is your stroke. So what will happen is, when the blood vessels become thicker and thicker, it is more prone for bleeding. So when there is a bleeding happens in your brain, which is called stroke. So all these are the consequence of high blood pressure. And why it is called a silent killer is, most of the patients don't come to the clinic for having a high blood pressure. But it is very important to measure blood pressure at least once in 3 months or something, to determine that whether you are a hypertensive or you have a normal blood pressure. So the silent killer is because people don't realize it and then don't have any symptoms. So many people with even a high blood pressure of 170, they don't even have any symptoms. So that is why it called a silent killer. Once you have a high blood pressure, your chances of heart attack, stroke, renal failure all increases as the number of years you have been untreated with a high blood pressure. So how do you control blood pressure? So there are certain simple things to implement when you have a borderline hypertension. If you say your blood pressure is not normal, it is just beyond 130 but below 140, then what you should do is certain lifestyle changes. Do regular exercise, do regular walking, stop smoking and quit alcohol, and reduce your weight, decrease your sodium or your salt intake, increasing potassium. These are all will help you to reduce your blood pressure if you are on a borderline. Sometimes if a blood pressure is already highly elevated, then we may not have time to implement all these lifestyle changes. So you need to be on certain medication which can make your blood vessel dilate or become little bit flexible so the pressure can drop. So concurrently you can do all these lifestyle changes, and if it is implemented properly, and we can able to taper the drug. So all we want to say is, high blood pressure is one of the most important cardiac risk factor and should be addressed adequately to prevent heart attack, stroke and renal failure. Thank you. ஒரு இருதய நோயாளிக்கு bypass surgery, angioplasty சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. ஸோ இதற்கான மாற்று சிகிச்சை முறை EECP, Enhanced External Counter Pulsation, Heal Your Heart, Vaso-Meditech EECP Treatment Center.